Thank you for coming. Welcome to Emergency. Appreciate everybody being here today. This is EMS Week 2026. It's a very unique EMS week for us. The theme this year is improving outcomes together, meaning that it takes a village. It really takes a group of people to come and make a difference in other people's lives, and that's what our mission is about here within our organization. So today, we're very excited. We have some awards that we're going to give out, and we also have a very big clinical announcement that we want to make, something that's very life-changing, something that's very transformational. That word gets thrown around a lot, but I can tell you and assure you today what we're going to announce and talk about with our guest is truly transformational and will make the difference in the lives of people here in Erie County. So first on the agenda for this afternoon is our Spirit of EmergyCare Award. Every year we have one of our peers that is nominated by their peers for the Spirit of EmergyCare. What it comes back to is somebody who bleeds our mission and what we do in the community every day. And our organization is very unique in that, as a nonprofit, we are completely self-sustainable when it comes to all of the resources that we need. Whether it's the clinical staff on the street, whether it's our mechanics in the garage making sure the vehicles are on the road, whether it's our communication center staff that intake the calls and make sure we're sending resources to the right places. Everybody here within this organization plays a very key role. And so this award goes to anybody in our organization that is nominated by their peers and is able to show how that person executes that mission every day and has the goodness of their heart and the people that are on the other end of the radio and the phones and of the care that we provide has that to be their forefront of everything that they do. So I'm going to invite our Director of Development, Karen Jekyll, to the front, who's going to read the nomination and make the announcement. Karen?
I have the privilege of overseeing the Spirit of EmergyCare Review Committee. And so I get to read all of the nominations along with the members of the committee. And then they go over all that information and vote on who they feel they should get it. And we are really excited about this year's nominee. So we are proud to announce that Lisa Skiddicat is this year's recipient of this distinguished award. Lisa's journey with EmergyCare spans more than a decade and reflects a deep and enduring dedication to patient care and service excellence. She first joined EmergyCare in August of 2014 as an EMT, where she quickly earned a reputation as a calm, skilled, and compassionate partner. Colleagues describe her as someone who brought not only strong clinical knowledge to every shift, but also consistently a positive attitude and genuine care for every patient she encountered. Even during the period when Lisa made the decision to step away from EmergyCare, but then she thought better and came back, she never truly lost her connection to EmergyCare. Lisa continued to represent the Spirit of EmergyCare in many, many ways. In 2023, Lisa returned to EmergyCare family as a non-emergency call taker in the communication center, where her impact has been both immediate and lasting. She brought a fresh wave of customer service excellence to the call-taking room, quickly mastering the technical aspects of the role while setting a high standard for kindness, competence, and efficiency. Discharge planners, healthcare partners now regularly ask for Lisa by name, praising her as pleasant, easygoing, competent, and great to work with. And I can attest to this because every time we go someplace where there is a healthcare professionals or social workers, they always compliment Lisa and they want to know if she's there. So we might have to take her in the future. Beyond her operational skills, she is known for her unique ability to bring calm to challenging situations and order to complex circumstances. She's often recognized for helping resolve difficult transport issues, accommodating changing facility needs, and getting patients home sooner, all while ensuring everyone involved feels heard and supported. Her leadership and reliability has also made her a trusted mentor and a go-to trainer for new call takers. Colleagues, as I said earlier, describe her as calm, caring, professional, and deeply supportive. She has a natural ability to take people under her wing, uplift others, and help those around her succeed. While her role today may not be place her at the patient's side, the compassion she shows on every call directly shapes the patient's experience. For many, Lisa is the first voice they hear from EmergyCare, the one that sets a reassuring, professional, and caring tone for everything that follows. Lisa Skidakat exemplifies what truly means to live the spirit of EmergyCare. Her dedication, kindness, positive influence extend far beyond her job title, touching patients, co-workers, community partners alike. Congratulations, Lisa, and thank you for being such a powerful reflection of our mission and values.
I've known you too long.
You want to say something?
Thank you.
Thank you. Thank you. I've known Lisa for a long time, long before she was at EmergyCare. And I worked with her and her husband, John. John and I have taken care of a lot of sick people together through the years. We have a lot of stories in that, and Lisa was right along at his side. And it's always an honor to see this award given out every year because, these are people that make a big difference in the community. And most of them you don't know. Lisa's name you might not have heard before today, but understand that our community is a better place and our region is a better place for the work that she does every day. So if I could get one more round of applause for Lisa. Next, I'd like to move into our clinical quality awards and have Justin come forward. Justin is our director of clinical quality. So a couple years ago, we decided we really wanted to revamp how we recognized employees for the clinical care that they provide in the field. Because what you have to remember is we're not like a hospital. We're not like most healthcare providers. We go meet the patient where they're at in their time of need. So whether that's the middle of a cornfield out in Green Township, if it's in the middle of out on the train trestle in McCain County, or if it's in the city of Erie here up on the 8th floor of a building downtown, it doesn't matter. We take the care to where the patients are. This past year, we were recognized by the American Heart Association for our efforts in improving our STEMI and stroke care. And we blew those metrics out of the water. And that comes from the team that we have internally here, and our staff made that happen. And Justin oversees that clinical care in his department with the assistance with our medical director, Dr. Chris Camerata, who's also back in the room. They're the ones that oversee that every day of what we do here, and also ensure that we provide the training and the expertise and the tools to our staff. So I would like to invite Justin forward so he can talk more on the awards for this year.
Thanks, Dave. So this year's Clinical Quality Award recognizes the clinicians whose dedication and performance made our AHA recognition possible. It was easy for us to acknowledge that we were recognized as an agency, but behind that agency name are the individual providers that make that possible every single day. So this award focuses on the individuals that have consistently elevated the standard of pre-hospital care throughout the past year. It focused on clinical practice, meticulous documentation, and active participation in quality improvement initiatives throughout the year. These providers have all driven meaningful improvements in outcomes for patients experiencing stroke and chest pain throughout the past year. And it reflects their commitment to not only their patients, but advancing the system of care in Erie County and beyond. Now, this year, it's a little different. Most of our recipients are from our outer regions, so I encourage you to stay tuned to our social media throughout the week. We're going to spend a day focusing on each of these providers as we go throughout EMS week. And I'll turn it back over to Dave for announcement of a clinical development.
Thank you, Justin. So very important, make sure you're following EmergyCare's Facebook page, as we're going to be featuring all these individuals. Unfortunately, our staff do not like cameras a lot, nor do they like to be the center of attention, nor do I, which is why I'm sweating profusely up here right now. So that's how we are. So next is something that's very special. I mentioned earlier the word transformation. And so when we talk about transformation, we talk about things that go and really make a difference in the community and the footprint that we serve. And so today we're announcing rolling out this transformational process. We're starting in Erie County with this program because of the logistics that go behind this. But, we've seen the clinical care in our world just continue to improve over years. This is going into my 25th year in EMS. When I started doing this, we had to call medical command to give baby aspirin. And now we have that order being given by 911 dispatchers over the phone. The medications that we gave were pretty limited back in time. Justin and I started pretty close together many, many years ago. That's our paths crossed even way out of state here. And that's how we ended up back working together today. So we've seen the system come a very, very long way in a very short period of time, because really 25 years really isn't that long. At least that's what makes me feel young. So today I'm happy to announce that within the next 2 weeks, we're going to start to carry actual whole blood in the Erie area on our supervisor vehicle, and also have more deployable resources. So that way, when somebody is suffering from hemorrhagic shock, or they reach a shock index or a condition to where they are unstable, we're going to be able to take, again, a very advanced treatment to the field to where that patient, to where they're at. We haven't seen advancements like this probably since AEDs or the defibrillators that you learn about when you take a CPR class, that they've been put out and actually used in the public. There hasn't really been a clinical advancement since that. All the other stuff is, it helps, it does, it improves things, it makes the job easier. But honestly, we're talking about saving lives. The one thing that there's no fluid, that there's nothing else that we can replace artificially in the field, is blood volume. And that's what's very, very key when somebody, whether it's a traumatic injury where somebody is bleeding out because they've been critically injured by, whether it's a motor vehicle accident, whether it's a gunshot, or if we're talking about a medical emergency. And that's the one thing when we went back and looked at our clinical data to when we really evaluated whether this program was needed. And we go back and we find medical emergencies to where this blood is very, very key in saving lives. So the fact that we're going to have a model here for the EmergyCare footprint local here at Erie County to be able to go out and deploy this in somebody's time of need is completely life-changing. And even if it saves one life, it's going to be worth all the efforts of what we're doing here. The county executive has been very open that we are working on trying to come up with a plan to where we can deploy this, not just for the EmergyCare footprint, so we can make sure that this is available throughout Erie County. So that way we can get this resource to anybody that's in need in the entire county. But it's one of those things to where we'll walk, we'll jog, and then we'll run to make sure that we get our protocols, we get our processes, and we get everything down pat. So that way this just becomes just another thing that we do every day. And so this might not sound exciting to a lot of people, but for those of us that have been clinically treating people for a long time, we know what this means, and this is going to save lives. And that's what this organization is committed to, is saving lives and bettering the people, healthcare in the communities that we serve. And so it was ironic. Our planned announcement had nothing to do with the actual theme for EMS week this year. That was all by chance that it fell together. But again, this is about improving outcomes together. And it really takes a village to help people. And that's what we're here to do now. And so I'm going to invite Justin back up so he can speak to some of the specifics, because he is the one that I chored with putting this program together back in October. And he's pretty used to me coming up with crazy ideas and being like, here, figure out how this works. And he did it. So him and his team did it. So Justin?
Yeah, so October of last year, Dave approached me about ideas for advancement of care at EmergyCare. And prior to my time at EmergyCare, I spent over a decade in the air medical industry in medical helicopter rescue. And in that time, I've seen the impact that pre-hospital blood programs can have on patients. I've seen the lives saved. I've seen the improvement in survival to discharge and functional outcomes. So this is definitely something that's near and dear to me and something we wanted to pursue. This has been a very challenging process to go through. Any advancement of this scope requires a lot of dedication to doing it the right way. But one of the biggest helps I've had throughout this process are the partners that we've had. So members from the Community Blood Bank that have been helping us throughout this entire process, and also members from the Erie Community Foundation that are present, who I'll invite up here in a second. They've been the key partners in this program to make it possible. And if it wasn't for their help, we would not be standing here today announcing this exciting development. We are anticipating, like Dave said, in the next few weeks, we're going to be going live with the blood program on the supervisor unit and expanding this as we can and throughout the EmergyCare footprint. So with that said, I'd like to invite up our partners from the Erie Community Foundation. Erin, I'd like to bring you up, please.
Good afternoon. Good afternoon, everyone. My name is Erin Fessler. I'm from the Erie Community Foundation, and with me is Rachel Cashone. She is our Director of Community Impact, who brought this grant to life and to our attention. Before I say a few words, I just want to thank EmergyCare, because 2 months ago today, my dad passed away at home, and that was because hospice and EmergyCare brought him home. Otherwise, he would have passed away at a nursing home. So if it wasn't for them, that gift would have never happened. Anyhow, at the foundation, our role is to inspire, engage, and empower donors and communities across the region. Today is a powerful example of that mission right in action. Through this grant request, we learned, as you just said, that individuals experiencing severe trauma and blood loss have the greatest chances for survival when treated on the scene before they even reach the emergency room. By administering whole blood directly to patients at the scene, EmergyCare is empowering first responders with life-saving tools. What also makes today's grant of $37,465 especially meaningful is the scale of its impact, because EmergyCare serves communities across the Erie County. Now, whether someone is on a rural roadway, at home, at work, people throughout our region will have access to a higher level of emergency care when it matters the most. That inspires hope and increases the potential for survival. This grant was also strongly supported because the program reflects thoughtful planning and collaboration and long-term sustainability. By bringing together EmergyCare, the Community Blood Bank, and regional partners, this initiative truly engages our community while ensuring blood products are available on the spot. So today's investment in EmergyCare is about one thing above all: saving lives when minutes matter the most. And that represents more than a one-time investment. This is a step forward in how emergency services are delivered across our region. At the Erie Community Foundation, we often say, we don't know what the needs of the future will be, but we do know we will always need our community foundation and our donors to meet the moment of need, when it matters most. So we are proud to support EmergyCare, and we are excited about what this means for the health and safety for all of us. Thank you. Sorry, I'm supposed to introduce Deanna. There you are. Sorry. Sorry.
Hi, so I'm Dee Rosenthal, Executive Director of the Community Blood Bank, and this is Laura Kramer, who's our Technical Director at the Community Blood Bank.
Yes. We are honored to partner with EmergyCare on this critical initiative and life-saving service that will provide for our community. Both of our organizations share the same commitment, ensuring that patients receive the highest level of care with every second that matters. Within this collaboration, blood will be available earlier in emergency situations, improving outcomes and providing better care for the communities we serve. Community Blood Bank's mission has always been to ensure a safe and reliable blood supply for our community, and we are proud to support EmergyCare's innovative prehospital transfusion program. We look forward to working together and advancing emergency medical care throughout our community.
So this initiative is just another powerful example of how the blood donors in our community truly save lives right here in our community. To show support, we're inviting all of you to come to a joint blood drive between EmergyCare and Community Blood Bank. It's going to be here this Wednesday, May 20th from 10 to 2. And, every donation has the potential to save up to 3 lives. And as always, every unit donated with the Community Blood Bank stays local. So your friends, family, neighbors that are in need of blood have that when they need it the most. And we're just, again, so excited. This program starts with generosity and ends with survival, and our community makes that possible.
Thank you very much. Like I started with all of this, it really takes a village. And as Justin said, it takes partnerships like this to really make a program like this get up off the ground. So that wraps up our press conference and our event today. We'll be around to be able to ask and answer any questions. The equipment, very similar to what we're going to be carrying here very soon, we have up here on the table. Awardees and their certificates are up here as well. And we thank you all for coming today and helping contribute to our mission by just being here and showing your support. Thank you.